All right. I hope that everyone can hear me. We're going to start in about 2 minutes. We have about 548 people registered for the webcast, which is an average number for these events. And we presently have 111 registered to attend. Normally, for example, the last time we had 178 attend. After the webcast is over, the PowerPoints and the recorded YouTube webcast will be sent to all registrants, which obviously includes attendees. And we'll still be open to answering questions. Dan and Susan, I'm sure, will be happy to have you contact them with specific questions that you might have. And after, perhaps a month later, we'll send an email out to everyone asking if they have any specific questions for either of the particular projects that they're going to be speaking about. We hope to keep this whole thing down to about an hour. I don't see any reason it can't be completed. I'll speak briefly to start with. I'm afraid I have a sore throat today, so I'm going to try to minimize my talking. And speakers, Susan and Dan, if you do speak, the camera will show you. If you're not speaking and you cough, which is sometimes what happens to me if I'm not careful, the camera will switch to you while the other person is speaking. So if you're make sure you're muted. What I'll be speaking about initially is the kind of standard questions that people have asked me over the years about housing, transitioning, and discussing briefly the most common options that people talk about, put into place. I think most of them will be fairly evident to the people that are taking part. The question about the transition, what will happen to my child when I'm gone? A lot of people have made a transition. I guess we're starting. A lot of people have made a transition because approximately 15% of people on ODSP are living with family, parents quite often. Perhaps the parents are gone. They're living with a sibling, brother, sister. So those people, in some cases, their transition is already planned in the sense that they've already gone to live with a relative. But for the most part, I don't think they are. I think it's a matter of the child living with the parents. And in a lot of cases, the family, the parents, the child can remain in the home longer than either of them could on their own, if at all, because the child can often help with snow shoveling and taking out the garbage and picking up the groceries, all of those good things. So both the parents and the child benefit. And then the other 85%, a lot of them are in a transitioning situation. They're not at home, but they're not really where the parents would like them to be. So there's a transition that has been made, but it may not be the best one. And so we'll discuss that. And then that specifically, where Susan and Dan, who will introduce themselves, come in offering a couple of very current options, one in Eastern Ontario and one just on the east side of Toronto. As a part of the invitations that we sent out for this webcast, we received 3 more contacts from other organizations. They're more, they're different. So we'll be doing another session next year, probably early in the new year, for 2 or 3 organizations that have other alternative ideas, which is wonderful. Also, just in closing, if you have ideas of other topics you'd like discussed, let us know. We are very close to 10,000 people on our newsletter list, 9,666 as of 2 o'clock today. And so, of course, if you're close to 10,000, and if slightly in excess of 500 have registered as they have today, that's a substantial proportion. And we now have 195 registered. So of 548, 195 are registered. That's roughly half. So I think that I think we can proceed now. It's 4 after 7. And I think we can get on with the rest of these things. Diane, can you hear me all right? Because you may have to help with some of the questions. And
I can hear you good.
Okay, fine, thanks. And those attending will see that there's a question option, a Q&A option. Hi, Dan. I see a very specific one from Dan Keogh. What housing options are available in Ottawa? Well, that's slightly beyond the scope of this particular discussion, but that is the question. What housing options are available in blank, blank, blank? So, how you doing, Dan, by the way? The first question that people have for me is, if I come up with some arrangements for my child, what will happen to their ODSP benefits? Well, nothing. And in fact, what happens is, if your child is the one of the 15% who are living at home, then their benefits will increase. It'll go up from $896 a month to $1169 because there's a shelter component of $496 in the $1169. If anyone would like to discuss getting that benefit increased while the child is at home, simply contact us. Send email to Karen@kpopelaw.ca, and Karen will reply about how that works. It's a $273 increase. Similarly, at the age at which these kinds of transitions take place, it wouldn't be uncommon to have it coordinate with, coincide with the child turning around approximately age 65. 60. I'll have to change that. Would you change the slides, guys? Make it age 60 RDSP funding. So at age 60, the majority of the RDSPs that start to pay out, because people have made all their contributions, the money, grants and bonds are vested. I've done some simple calculations. I can give you the formula if you like, but bottom line is that if the RDSP amounts to $300,000 to $400,000, which they should do, it'll pay out approximately $8,000 to $12,000 a year over a 23-year period. So as far as the funding for the housing, this is one source. The person will continue to receive ODSP until age 65. That's where this confusion came in. So they'll continue to receive ODSP of approximately $14,000 a year. That's the full 1169 times 12. Plus, they would receive the amount paid on overtime for the RDSP. Now, of course, this will only fit with children who qualify for the disability tax credit. And when they turn 65, they will then receive old age security and guaranteed income supplements, which total approximately $18,000. So their benefits will go from $14,000 on ODSP maximum to about $18,000 plus RDSPs if they fit into the picture. And the RDSPs won't affect the guaranteed income supplement portion of the OAS-GIS. Let me take a look at questions. I see there's a question here about the subsidized internet. Right now it's relatively restricted. If you Google Ontario subsidized, Canada, Ontario subsidized internet, you'll see that there's a new initiative that started last year. And basically, it started out as being available to people who lived in certain subsidized units owned by the government. Well, okay, but that's restricted to, you know, those kinds of community housing, rent geared to income units. And right now it's on a random basis for people who receive, like, who have children who receive the maximum Canada child benefit, which means that you're in the lowest income bracket, which obviously if you're on ODSP you are, but it's not something at present, unfortunately, that you can apply for and simply receive. It's a randomized thing, but one hopes that that will change. The electrical subsidy is open to anyone who is on a low income. So the electrical subsidy is available to everyone. And I think everybody who is on ODSP, who is paying for hydro, should avail themselves of that. It's a straightforward process. It's not complicated. No, you can't apply through ODSP for the subsidized internet. It's far too simple for that kind of thing to happen, right? With respect to Michael Agnes, is the shelter portion of siblings ODSP reduced if we were to buy a condo and put it in our sibling's name? No. As long as the shelter costs paid by the person on ODSP are equivalent or greater than $496, then they get that maximum amount. Okay. Next slides. I'm going to try to finish my part at 7:15. So the kind of standard ideas, alternative options that people have discussed with me over the years are, firstly, of course, simply private apartment rentals, where the child moves into the apartment. Perhaps there are some supports available. Perhaps there's some funding for supports. Perhaps the parents are the supports. But one way or the other, the child may be able to successfully live in that apartment. But of course, they can't afford it because it's, say it's $1,500 rent, plus hydro, etc. So what happens is the child pays $500 because his shelter component is $496, and the parents subsidize the additional $1,000. Quite often, the parents, of course, also wind up signing on the lease as one of the tenants. And what this does is it means that if they structure it that way, is that they can pay that $1,000 a month with no repercussion on ODSP, because all they're doing is they're paying what they consider their share of the rent. It's not part of the $10,000 over 12 months paid to the child. It's paid directly to the property manager as a part of their responsibility for their tenant liability. Multifamily private group homes. I'm familiar with a few successful projects like this, where families get together. Perhaps their children have been in programs together. They have similar disabilities, perhaps. They're compatible. They've known each other perhaps for several decades. And the family gets together and they, in one way or the other, have a private group home. So, I mean, the home could be rented, could be the family home of one of the families, could be a home that the three families have purchased together in some structured way. You know, you don't have to get into the nitty-gritty of that. It's just a matter of a multifamily private group home option. Now, of course, this would be most suitable where the children are largely self-supporting. But of course, if you have a 4-bedroom home, 3 children living there, plus 1 caregiver, particularly for overnight concerns. Why wouldn't that be something that is quite possible? One of the most common things that I've had over the years is a family wanting to know if they gift their home when they die to a group such as community living, on the basis that community living promises to provide for care in the home, wouldn't this be sweet, for the rest of the life of the child, perhaps along with a few others, right? Well, that's a nice idea. And what happens is typically the charitable group, in some cases, it is something enticing to them, can be, but most of the time they don't really need the bricks and mortar. It's the $60,000 a year support cost, which doesn't just come out of thin air and can't be taken from others just because your family is donating a house. So it's not really as viable as you might think, although it sounds like a great idea. I found that in some cases it is acceptable. It happens to fit. For example, with that particular community living chapter's plans. And often I find that it's coinciding with the mental attitude, the approach, the entrepreneurial approach of the executive director of that particular chapter. In my experience, with all due respect to executive directors of charitable supported living organizations, the corporate ethic for some of them on the part of the executive director and the board of directors is, well, no, that's not our job. You know, it's just not our job. It's too risky. Not what we signed up for. No, thank you. That's fine. Others say, that's interesting. Well, that's just down the block from the other house we have, and it's being gifted to us, and it's worth $500,000. We're going to make this work. So it really does turn on who you're dealing with in those scenarios. Private supported living corporation, that would be a private alternative. Well, for example, when all of the now long-standing organizations started out, for example, years ago, third Thursday of June, I spoke in Kincardine, and it was the 40th anniversary of the Kincardine District Community Living, KDACL. And I met that evening with a couple. They were in their 80s, and they were founding members. And I said, well, how did this all happen? And they said, well, 40 years ago, our kids were all getting out of school, and there was nothing for them to do. This is how real life works. And then 40 years later, well, of course, it's an institution, right? And so there's no reason that you couldn't have a private supported living corporation. It would just take a bit more creativity to start with. And then, of course, one of the most common is, should I leave my family home to the Henson Trust for my child and have the child live there? Well, there's no reason you couldn't do that at all. And if the child lived in the home, it would qualify as a principal residence. It's capital gains tax exempt. One day, years, decades later, the child dies, house is sold. It's a tax-free investment. The residue of the child's trust goes to his siblings or to their children. But it's also true that often that home is too big for that child. Yes, you could find other kids to live there, that's true. But often you downsize. But it wouldn't be uncommon to find that the home was left to the Henson Trust. It was sold. and then a smaller property was purchased. It's entirely possible. Let's just look at a couple questions, and then Susan, I'll turn the table over to you. Yes, having a child put onto a guaranteed income living list. Well, it's true. When they say, you know, it may take 10 years, that's entirely likely. And of course, as long as the child is happy, secure, safe, living with you, they're not really, you know, on a waiting list or on a sitting list. Because why would they place that child in a spot if they're safe and secure and home with you? So you could, of course, wait to die. That'll move your child up the list. We do have a process for expedited placement. Sometimes things simply have to be done sooner. You know, it's just not a plan to wait for the parents to die. So if you'd like to discuss expedited placement, let me know. It's not easy. It's harder recently because we used to be always we used to always be able to count on certain emergency shelter to be available, but it's much harder right now to find that kind of emergency shelter. Buying a home for the child. Yes, you could buy a home, could put the home in the child's name. Of course, the child can't carry it. Then you'd have to subsidize them. This would affect their $10,000 over 12 months, or you keep yourself on title as to 1%. That'll work. I've only seen a couple of cases where it was appropriate to actually put title in the name of the child, but that can't work. So I'm going to shut up. It's 20 after 7. Susan, would you care to introduce yourself and to discuss your project?
Be my pleasure. Thank you. And I think you have a slide for me.
Oh, yes, thanks.
Mm-hmm. My name is Susan Hagar. I'm the owner of a company called Nurse on Board, and we are in 8 regions in Ontario. Started here in Ottawa, so there's 23 nurses, and we are doing private care management. And by care management, I mean navigation, advocacy, and connecting all the dots in terms of medical care, community care, and so on. And the reason I started this business is I could see the trouble people were in healthcare, really drowning and not knowing which way to go. And so it made sense to me that highly experienced nurses with varied backgrounds could support people in a meaningful way. And as it turns out, we're doing very well. And in fact, we are able to support people, the power of attorney, and deal with all the complexity. And we know that healthcare in Ontario particularly is struggling, and people are struggling within it. So we deal with people, be it in the medical situations in hospital or otherwise, and connect the dots in community care, make sure that they are having all the support that they should be getting, that's government funded, advocating for that all the time. But our role really is to spot problems before they become serious ones and keep people out of the emergency room and out of the hospital. So I would say 75% of our patients are seniors, but we certainly have a number of younger people and some patients with disabilities. And in speaking about the Shire Village, I would like people to know that this option that's forthcoming, although it's called a seniors village, is really meant to be an inclusive village. So where there are people with disabilities, they would absolutely be invited to be part of this village. Similarly, people who are independent could be 50 years old and just decide they don't want to own their own home anymore, plan to travel or any other thing. So we'd like to create a true village where every size and shape, ability is welcome there. And we're excited about it. We're starting in Alexandria, which is about an hour east of Ottawa, and there's a huge demand in other parts of the province and certainly throughout the entire country. So we've been down to New Brunswick, where they're really able to think outside the box, and we have land there and also in northwestern Ontario. So I think we are going to see many villages coming forward, and I think you'll understand why when I explain what the design is. So Shire is the name of the village in Alexandria, and as you see the three tag words, home, health, and happiness, so I'll speak to all of those. So the home part of Shire is a village with small homes, likely about 400 to 850 square feet. And I should tell you that if everything goes according to plan, we would have people living in this village perhaps later next year. We would like to start the build in the spring. So these homes are lovely, accessible, barrier-free homes, radiant floor heating, and as I said, accessible. And we would be building them in groups of about 70 in different phases, so that the land, for example, in Alexandria, over the next 5 to 10 years, there would be room enough for about 700 homes if there should be the demand, which we expect there will be. The idea is a campus of care model, really, where it's a nurse-led community, and we would have a hub, which essentially has retail services, but has healthcare, and the healthcare I'll speak about. But the idea is that everything would be there that people would need in a village, which is very helpful, of course, and healthcare included. We would want to design a village where everybody has input in that area. So we've been having focus groups in Alexandria to hear what it is that people want. And our goal is to keep people in these rural areas. They do not want to leave their families and friends and go into the big cities or to where there's retirement residences. And people need an affordable option, as everybody here knows. So where you would be spending perhaps $4,000 or more in a retirement residence, it will be half the price to have your small home in this village. So in Alexandria, we would be looking at about $1,500 to $2,000 per month. And in all the villages, we have promised to have subsidized units, so there will be perhaps 10% that will be subsidized. It's not a rent-to-income type of situation, but it really is a village model, a community model. And when we look at the actual homes themselves, although there's these small homes, we actually will have an apartment unit type style, because many women have told us they do not want to be in their small home. That makes them nervous. They're afraid. They feel like there's safety issues. So we are happy to have a low-rise type apartment. We also will have clustered units. And that's important where people have cognitive impairment, or perhaps they have disabilities and they need extra help. So what the idea of clustered units, as you may understand, is that they would have their own home, but they would share a common space and therefore have assistance with meals and other activities of daily living. And there would be, in this model, when you think of the pricing, this is for the home and for the nurse care management to be included as part of that. So the role of the nurse care manager really is to connect all the dots, make sure that people are getting the medical support that they need, the community support that they need, and the oversight that they need to be safe. So the homes themselves will perhaps vary from one region to another, but for now we are going with a home that has no basement, obviously, because there's no point in that for people who have any mobility issues. We don't want to have the costs incurred for that. The health side of it is exciting because people also don't want to drive an hour away to deal with healthcare. So the vision is we would have nurse practitioner led if the funding for healthcare in Ontario will allow for that, and there's some changes, but we expect we can do this. And we will have physicians by telemedicine. So people can see a specialist right there in the clinic space or actually in their own home, and they do not have to leave, essentially. And they will have the nurse care managers and the nurse practitioners to support them. And obviously, where they need to, they will leave the community, but we hope to keep them there at all time. The happiness aspect here is really about a culture change philosophy that we seek to embrace. I often speak about the Eden alternative because it is a worldwide philosophy movement that was started by a geriatrician physician in the 90s in upstate New York. And it is an incredible philosophy that addresses the three plagues that seniors deal with, that people with disabilities deal with, and that would be loneliness, helplessness, and boredom. And there truly are antidotes to these three plagues, and it requires education and support to have a community wherever it is, whether even if it's a nursing home. It means that we need to embrace a culture change. So we are going to build these villages with this culture change in mind, so that we really truly do support people. We do not have a goal of segregating people. Also, we think that that's counterintuitive to only have people together who can't help each other. A true village, a true community has people helping one another, and we wish to support that. So within Shire and all the other villages, what we will have is care partners, and those care partners would be maybe traditionally known as PSWs, but the idea is that they're partnering in the care, and the individuals living within the village also have opportunities to provide care. So typically we would have children, we would have pets, we would have raised gardens, we would have meaningful activities for them to participate in. At the reasonable price, say of $1,500 a month for a lovely home, clearly people would be paying for the a la carte services that they need. So unlike retirement residences where you may be paying for things that you don't want or need or use, you will be paying only for what it is that you want and need. So where we need to facilitate a meal program, we'll do that, and people can pay for that. Similarly, where they would need PSWs or care partners, then they would be paying for that. And we believe that the beauty of it is it'll be so much more affordable in a village setting. You won't have people, PSWs, traveling around from different neighborhoods in a city, which drives up the costs. And so there will be a definite benefit in having people within the village providing the care. Also, really knowing people in this type of village setting, we think will be a huge improvement in their quality of life. So, of course, costs will add up, but when you have your nurse care manager advocating, we will be ensuring that people are getting the support that they deserve to have that's government funded. And often that gets missed because people don't know actually what the eligibility criteria is for care in the community, and we do. And we make sure that the people their needs are known and understood, and that they get this care in place. And so we think that we've covered really the lovely homes, the healthcare, and with the philosophy that this will really create a life worth living. And that is a book that Dr. Bill Thomas wrote. This is the physician that is behind the Eden Alternative, and it's called A Life Worth Living. He's written many, many books. They're also starting these villages similarly in the US. It's going to be in a couple of years from now. But I think you will find that we will have more and more of these villages in the province and in the country because there's a huge demand. Less than 5% of Canadians can afford to be living in retirement residences, or some of the other housing options are really just too expensive, and you don't have good oversight. And so it's in some cases a setup for trouble. And we believe that highly experienced nurses in this type of environment will be a very positive experience for all of the residents. And I'm open to hearing from anybody at any time. Feel free to reach out to me. The contact info will be shared, of course, at the end. Happy to answer questions about the village. I do want you to know that given we're building in phases of 70, that we already are accumulating a waiting list, and there's no cost, no down payment to be on this list. But the idea is that when your name comes up, then you will be given the option to have a home, and we will be building based on what the demand is. So we are taking names now. We haven't done any advertising even for Shire, and we may have already hit the first 70. We're certainly getting close if we haven't already. So the demand is clear. So feel free to reach out to me, and I would be happy to explain more about that, or certainly explain about how Nurse on Board is assisting people in the community to stay in their homes and be well cared for and have everything in place that they need.
Susan, I have a couple of questions for you.
Mm-hmm.
Who pays for support of those requiring more intensive support? Are you looking at passport funding for those of individuals with special needs? What programs will be in place for those with special needs during the daytime or nighttime?
Great, good questions. So we absolutely, we have had some focus groups also with families where there's an individual with a disability. And we're doing our best to be up to date on what all the options are in terms of passport funding and otherwise. So we would be facilitating all of those things in the village and making sure that where there's paperwork involved and forms to be done, we would be making sure these things happen. The funding, of course, this is a essentially a landlord-tenant situation. It is a rental model. So where the nurse care managers would endeavor to facilitate all of these programs, the reality is that the financial burden would be the same as if you were living in your home in any area, or if you were renting in any apartment building, except that you would have people on site who would be assisting and would be knowledgeable about what's available within the community for funding. And we know that that's, of course, an ever-changing landscape, and we would want to stay up to date on that.
Did you say that the cost of the nurse services are covered within the rent of the villages?
Correct. The nurse care management is, so where somebody needs nursing care per se, if they have dressings to be done or other things, then that's something that really should be paid for and served by the government. But the reality is there can be gaps in care. So you would have highly qualified nurses on site. The nurse care management is absolutely included within the rent. And it would really mostly be the other supportive services that people would be paying for.
And I'm going to ask this question so you can reiterate your answer. Is this for elderly people only?
Right. So to be a true village, we think not. We believe that anybody can live in this village. We expect that young people wouldn't want to because there would be a demographic of people who are older. However, we will welcome anybody to live in that community. It's important, I believe, that we do have a variety of people.
Would there be an option for congregated living in the village? Some of our children would not be comfortable living alone.
Yes. So the larger homes, so where you're looking at the ones that are closer sort of in the 800 square feet, are 2-bedroom units. So that's absolutely an option where people think that that's more suitable for them.
Okay. Do you have any final, you're welcome to continue later. Do you have anything before I have Dan introduce himself?
I don't think so. Other than to say that we really are seeking people's input and feedback on what could make things better. So I invite people to reach out to IHA, which is Innovative Housing Alternatives Canada, or to myself, Nurse on Board, so that we can let you know when there are upcoming events in the community. Perhaps if you're near Ottawa, you might want to attend an event in Alexandria so that you could know what's going on and what the timelines are. But certainly feel free to reach out to me. I'm happy to speak to you about it.
Okay. Now everyone will receive these slides, everyone who's registered, let alone attending, as well as the video. So there'll be lots of opportunity for people to follow up. Dan, would you care to say a few words?
Yes, thanks, Ken. So my name is Dan Hughes, and I am the founder of Liberty Hamlets, which is a new development company in Toronto. I'm also the founder of another company called the Enhanced Day Program. The Enhanced Day Program has been working in Pickering for about 7 years now. It's a day program that supports adults with all types of disabilities once they graduate out of high school at 21. We actually specialize, though, with really the ones that wouldn't fit into your regular day program. We work with ones that are in diapers or aggressive or on medicine, that take medicine throughout the day. And so we've become specialists in the GTA, really, that works with everyone. We've never turned anyone away. We've been able to adapt and work with people. We have people from downtown Toronto to Markham, Uxbridge, and then all the way up to Bowmanville to come and attend our services. And so out of that has really come two things. One, I joined the accessibility committee with the city of Pickering, and I have been involved with it and sitting on it for about 5 years now. And with that came not one single design where there's actual accessible design units. We have always looked at how about the stairs, the parking, all those types of things, but we never actually got into a properly designed building that was actually built accessible. And so I wanted to build my own company that actually built accessible design housing. So Liberty Hamlet's first project is called Access Condos. This project is designed to have community space for everyone, but it is 22 towers that are 22 stories each. And is also the first building ever built in the world that is 100% built barrier-free. That means that we have added every item such as zero rise walk-in showers in each unit. There's wider corridors, wider doorways, accessible garbage chutes. All of these types of things have been built into the building from the very ground up. Access Condos will be built in Pickering, 1525 Pickering Parkway. And it's right up the road from what the city has now announced as a new youth and senior center, an art center, a library, the Pickering Town Center, and then 2 exits onto the 401. We're also about 300 yards away from where the GO station is. So it's very accessible. From the GO station, it is 25 minutes to downtown Toronto to Union Station on the Express. One of the key things for us is that we wanted to make it as an inclusive housing model. So 80% of our units are going to be sold to the general public. That means that it is first come, first serve, and same as any other condominium building. The other 20% of the units are actually being sold specifically to families that have a disability or an individual with a disability living in their house. 10% will be sold to those with a cognitive disability. 10% will be sold to those with a physical disability. This also will be sold on a first come, first serve basis, and people can start to register at libertyhamlets.ca for those units. One of the key things about our facilities is two things. The Enhanced State program will actually be moving into the second floor. There's about 4,000 square feet of commercial space that we'll be taking over. In there, we will have a commercial grade kitchen for life skills and social skills, working with and training people, gym, arts and crafts room, a TV games room, a cognitive therapy room, a snoozling room, and also outdoor space with a sensory garden, those types of things. Also on the first floor will be both a restaurant and a hall that we have partnered with the local branch 606 Legion. Will actually be coming in and using those facilities to provide food and support, and also providing events throughout the evenings and weekends for people in the building and for the community. There also will be a cafe. There will be 2 cafes. The first cafe will be a smaller one that we can actually train people that have disabilities to how to work with the money, how to cook, how to make the baking for the cafe, how to greet someone when they walk through the door. And then as they graduate from that program, they'll then move up to the front cafe that'll be up on the street on Pickering Parkway, where they actually will be able to work and interact and make money with people actually at the cafe there. The key things for our project is our builder. Fieldgate Construction is our builder. They're a top 10 builder here in the province of Ontario. Quadrangle is our architects and design. They have built over 44 and designed 44 tall towers here in the province. But one of the key things for them is that they are the only architectural company that I found that actually has its own accessibility design group right inside of their office. And so we have met with Human Space, which is their name underneath the Quadrangle banner. And we have actually had charrette and group sessions on our designs to make sure that our layout actually meets the needs of individuals, from those that are visually impaired to hearing impaired to physical disabilities, the family members that have an individual with a cognitive disability in there, to go through all of our designs and our vision and make sure that we were on the right track. Also, one of the other groups that's part of our team is MBTW. So they are a large urban design and planning company. And they have all bought into the concept of us building a fully accessible building the right way. One of the key things for us is that, and for me being in this field for over 20 years of working with adults and individuals with disabilities, is that we've often segregated people in this community. We've put them off into the institutions from 1953 to 93. We went over into the model then of taking individuals and moving them into group homes. But we also know that it comes with a connotation of the people on the street and how they approach these individuals. For too long, we've made it clear that not all men or women are actually created equal in our society and in our community based on race or age or ability. Liberty Hamlets is taking the steps right now to create a seamless housing solution that doesn't discriminate based on one's ability or age, but embraces those abilities and supports the individual in their own home. We want to make a successful, inclusive environment that's not simply accessible, but it's seamless. We have built it so that it's also cost efficient. One of the hardest parts for us to build on a building is the balconies. In 10 years, those are going to have to be replaced, and the condo corporation is going to have to start to have a reserve fund to replace those balconies. Well, we've gone with a French sliding door that has a block across it that allows for families to know that their maintenance fees isn't going to go more than 50 cents a foot, because there isn't any need for us to increase. All of our maintenance is already covered in those costs of our design that way. We're not going to have to replace the balconies because there aren't any. Things like that we've taken those steps to try and plan ahead. We are actually planning and working through the design of being LEED certified, which means that it says net zero, it's a green, it's an efficient building to help keep those costs down for families. And we also have a number of indoor and outdoor space. There are 3 gardens around the building. We also have a space right out the back door for service animals for those that have a service animal in the building. We have tried to take as much of the issues and concerns that we've recognized in the community for families and really take those issues and try and cut those back. One of the ways that we've done that is that we've partnered with Trillium Support Services out of the Peel region. They will be providing support workers, PSWs, and respite care workers right inside of the building, where someone that is in, say, Unit 306 can call down to the front, to the concierge desk, and can book services right there with the families, right there with the front desk. And Trillium Support Services can have supports there within 24 to 48 hours. We also know, especially with autism, that by taking an individual when the family needs to go on vacation or there's a family emergency, by taking them out of their own home and moving them into either a retirement home or some sort of special housing for a week when the family has to go away, often leads to a number of behaviors, either aggression or depression in the individual. And so for us, we would now be able to provide support services right inside of that condominium for the families, so that the family can go away and be on vacation or go for the emergency services that they need while we provide support right inside the building. And so that's really our model and what we've gone through and have built our model around.
That's an excellent presentation, Dan. I have a couple of questions for you.
Sure.
How many units are in each building?
145 are in each building.
Why only 20% available for special needs and not 50%, for example? The demand is so high.
Great question. One of the things for us is that we didn't want it to be an overpowering building with a lot of individuals with disabilities, because it might turn other people off of it, of moving into a facility like that. Our marketing tells us that probably about 20% of our families our units will be sold to families with disabilities, but another 40 to 50% will actually go to adults that are looking to age in place in the community. And so a lot of them will actually be using the services that we provide through the respite workers. For me, I know I've got both my parents have disabilities. My mother has fibromyalgia. My dad's been in and out of the hospital most of my life. So it'd be very easy for me to have them move into a condominium like this, where I can actually call the front desk and have them to check on their meds on Monday morning, make sure their meds are all set out, make sure that their sheets are changed once a week and those things get washed. And so by paying for those services at the front desk, I can actually make sure that there's actual care going on inside of the condominium, rather than my parents just being left on their own, those types of things. And so it really is a balance of how do we actually build that inclusive community of having families that don't have a disability living with families that do.
That sounds wonderful, Dan. We have 2 questions. What is the square foot cost for the condos? And similarly, what is the anticipated cost of a unit?
So the 2-bedroom unit is around 800 to 900 square feet in size. That's 2 washrooms, 2 bedrooms, stacked, rather than a stacked washer and dryer, side-by-side washer and dryer, larger kitchen, larger washrooms than what you would normally get in the Toronto market. Currently in the market, the units just south of us on the 401 are selling for $670 to $700 a square foot. We would be in the $650 a square foot, and that includes parking. So really, it's about $630 a square foot. So for an 800 square foot unit, you'd be looking around the $500,000 mark.
That's very competitive. Can a family of an individual with a disability purchase a unit, i.e., what category would they be in? Public offering or 20%?
Once the 20% is sold, there's no restrictions whatsoever on who buys the rest of them. So it's a first come, first serve. So there very well could be 30% or 40% of the families in the building actually have a disability that is there. So for us, it's once the market is open, which we're looking at the end of October, early November, for our sales office to be open and sales running. For us, we don't discriminate that once we hit 20%, we're not going to stop selling to those families. It's just that's where the market is that first 20 will be set aside, and the rest of the 80% will just go right out to the market. So it doesn't really matter to us who purchases the units. You're coming in, you're purchasing the unit, and then from there you can decide if you want to purchase services or things like that after once you move in.
There's a question here for me, actually. Can we send the video for this program to friends who are not registered? Yes, of course. Go ahead. Feel free. Just looking at some of the other questions that I hadn't passed on previously. Just give me a second. Susan, will these villages also be developed in urban areas, or are they serving mostly rural areas?
Mostly the plans for the villages are in rural areas, and mainly that's because of the cost of land. To get a large piece of land, it's really a model where we get the land for, you know, relatively next to nothing is how we manage to charge such a low amount for these lovely homes. So it will mostly be, I don't see us using urban area for that reason alone.
I see. Is there a website that we can go to see these buildings?
For the village, village I'm speaking to?
Well, I think both of them.
Okay, so if you go to IHA Canada, if you were to Google that, you will see the beginning of that. We don't actually have a village built yet, so you don't actually see the village, but you will see some drawings about it, some photos.
And Dan?
Yep, for the location at 1525 Pickering Parkway, we are our web libertyhamlets.ca. So HAMLETS.ca, and you can see actually the first renderings of the building being done through there.
Okay. Here's a slightly complicated one, or wordy anyway. Condos. Dan spoke to LEED certification. Would that not need to be done in the design phase with accessibility versus after, which it sounded like would be important to be a sustainable and green building in addition to accessible? Well, obviously that's a factor, but what level LEED certification are you aiming for?
So for us, we are looking at being at the gold level standard of LEED. We've actually even moved the buildings around once we've had the shadow studies and the sun testing done based on that. There is a lot of things that go into it. One of the key things for us is that once the interior design of the accessible unit is made, from the outside of it, the type of brick that we use or the windows and the glazings and those types of things that we use in there, all changes exactly what takes place inside of that unit. So once we have it accessible, that just changes the hallway space, the doorway space, those types of things. The walk-in shower, the low-rise showers, the ability to actually raise and lower the countertops based on the units and the upgrades that people want in that section. So the accessibility is completely different than the green design, and the green design is being handled by Quadrangle, as that's something that they specialize in as well.
You know, one of the things that interests me is that a lot of this is not rocket science. It's techniques and tools and implementation that we've had available for quite a long time. I mean, we're simplistically, we were doing accessible bathrooms and raisable countertops and stuff back in the 80s. You know, it's not rocket science. But what is interesting is that it's the actual implementation of these things. And I think that the market is ready myself. I don't think that it was ready before. You know, some years ago, in Ottawa at least, they built a bunch of life lease residences for older people. Well, there weren't enough older people who wanted to buy a life lease and kind of settle down that way at that time. You know, what kind of market research have you guys done on these projects? How do you know the market's there?
Well, I can say that there's been a lot of market research done in terms of the demographic of seniors is mainly what's been focused on, although there's certainly been work done on people with disabilities. You know, I think anybody on this call knows that the market's there. There's a huge number of people who have no options. So although we've looked at the statistics, I can't give them to you right now, but I think that the need is clear. We hear it every day.
And for us, we've done the normal community engagement of opening up the doors to what people would be interested in the community on the piece of land that we're purchasing. We actually fit into the city center zoning, and the city of Pickering has designed a specific area of Pickering as high density now. Because they see the need of people moving out of the city, the cost of Toronto is very expensive. And so moving east, as the western part of Toronto has become overly crowded and busy as well. So in Pickering, they've gone from having no condo high-rises in the last 10 years. They've now finished 3. In the market last year, one group of 270 units sold out in 2 hours. Another building that's attached to that property of 280 units sold out in 2 weeks. And now they're coming with a third building right on that same property. And their goal is to sell out in a week of 350 units. So the market in the GTA is very intense. We're also probably half the cost of what someone would get for downtown. So for us to be able to provide bigger space, more open access to the GO station, access to the highway, for us, it really is very simple marketing for us that way. And in our sales department there.
Dan, in the Access Condos project, is the day program a fee for service?
Yes, it would be. Same as it is right now. We charge in between $45 to $75 a day based on the amount of support that the individual needs at our program currently. Some of the individuals are on a higher scale of support, and so we work with the families that way. Some of them have passports, some of them don't. And so I've really built this place not to turn someone down based on funds or that type of model, but we've actually are able to work with them and help families through the passport application, through the regional transit application, all those types of things to get families in and through to the program.
Dan, what about security in the building? Will these be secured for those mentally disabled or seniors who have the tendency to elope when unattended?
This is your regular condominium building, so there will be concierge and security there, but it will be up to the families and the caretakers to actually show that they're able to take care of that individual inside of the unit. It is not our responsibility in that model for us to be able to, such as a group home or that type of idea of CAMH or a mental health hospital, to make sure that people are safe from eloping. That is up to the family to be able to provide that support and care inside of that unit for them.
Are the buildings units being designed with soundproofing for those of us who are sensitive to sound or sleeping odd hours?
Yes, definitely. We've actually, I've been working with CAMH specifically on a couple of different things. One is our levels of the insulation between the units. And the other one that we've actually really found out is that in Toronto, a number of people have the difficulty of the glue that they use to hold the flooring down in the units. The sensitivity to that on a cognitive level has caused a lot of people to have to just sleep and stand right by their window the whole entire time they're in their units. And so it's become a really big issue in Toronto because builders are going with the absolute cheapest stuff they can find to get it in and get it done. So we're actually working at ways that we can actually install floating floors inside of the units that we don't have to use glue and that kind of stuff to provide that security and safety for people.
Susan, you mentioned Northwestern Ontario as a potential opportunity for a village. Are you able to disclose where you're thinking?
Thank you. Actually, no, we're in preliminary discussions with the Federation of Northern Ontario Municipalities and Northwestern Ontario Municipal Association. So that those conversations have just begun, and we're having meetings with them next week. So I wouldn't be able to speak to anything specific at the moment.
I understand.
May I just, I wanted to add something in listening to Dan that I failed to say earlier that I think might be of comfort for people to know in our village setting, is that we've been working very hard to have the best technology possible in these homes, because there is a big concern about safety, security, and more. And we've been working with a number of companies. Bruyere Village Research Institute is one. And just to give you an example, I mean, the technology is so good now that you can know if a person didn't ever get out of bed that day, if they didn't open the fridge, all these kinds of things. So this is a kind of technology we're going to be building into all of the homes. People will have the option, of course, not to have that turned on if they don't want that. But we think that where we're having a large community and we have this hub where we have the clinical team, that we'll be able to, you know, the system would be sensitive to knowing what people's regular routines are and patterns and so on, and therefore we would be alerted when there was something unusual, or if somebody was at a wandering risk or other kinds of risks. We've really done a lot of work on having the best technology in these homes.
Well, that's excellent. It's just a moment before 7. No, sorry, 8. It's now 8 o'clock. We've had, presently have 198 attendees. We had 232 after we opened. If there's any final questions, I'll take them. But otherwise, the plan was to have this short and sweet, and then people can individually follow up with any questions that they may have. Are there any final questions from the audience?
We're just searching it here. Just give me one moment.
There was one question that was there about families who have an individual might need higher support needs, if they can have a live-in support worker. One of the key things for us is that this is your own house. We do not control who comes in and out of the units. And so for us, it really is that if the individual that you are taking care of needs a 24/7 support worker, then that's what is going in and out of the house. And that is your own unit. That is, we don't regulate those types of things. It's done by you guys, by the family members.
Okay, I don't see any new questions. I think we've done a wonderful job, don't you? So I'm going to close now. And as I say, if anybody has follow-up questions, they can be addressed both to Dan or Susan or myself. If anybody happens to be dealing with the issue of the benefit increase, that's still Karen at kpopelaw.ca. And other than that, we have a specialized session coming up for most months for the balance of the year. Next year, we'll do another program just like this, but with 3 other projects, which is certainly a gratifying thing to be able to advertise this webcast and find three new groups that say, oh, well, yeah, and we're doing this too. So I think that's a very heartening thing to find out. I'm really, really pleased. With that, thank you very much for taking part, and I'll see you again next time.